Okay, now we are going to explain our presentation topic that is about prevalence of injury in male soccer players of lower categories on the Tuluá Sports Club Corporation that is named Cortuluá in the year 2023, and the authors is Natalia Aricapa Flores, Isabella Vásquez Gil, Cristian Camilo Ramirez, and Donier Dominguez Cordoba. In terms of approach of our presentation, we know that the soccer is a high impact sport that carries a high risk of injury for both professional and amateur players. Injuries can be caused by direct or indirect contact, such as sudden movement, which can lead to the muscle, joint, or a ligament damage. Most injuries are minor or require 7 to 28 days of recovery, but about 10% are moderate or severe. Lower extremity injuries are the most common injuries in soccer. These injuries affect the athlete's physical health, mental well being, and athletic performance. To address this problem, the Cortula Sports Club and together with researchers will collect statistical data to identify the factors, risks, and the most common type of injuries in soccer, taking into an account the category and place of practice. The objective of this research is to determine the prevalence of injuries in players of lower categories of the Cotuloa Sports Club in the year 2023. In addition to what has been described, the observational transversal research will be based on the identifying the prevalence with which the 35 male players belonging to the lower category of the Cortula Sports Club present injuries during a playing season. The base age range will be between 30 and 17 years old, with a minimum of 3 months of belonging to the club, and who have not present any injury in the last 2 months. Semiological tests and tests such as the anterior ankle draggle anamnesis and the Visa P questionnaire were used to determine their physical capacities and conditions. The next are the objectives, and we can see that we have two types of objectives, that is the general and specific. We have in the general objective, that is to determine the prevalence of these injuries in lower level soccer players in the Cortula Sport clubs in the year 2023. And in specified objectives, we have three types, that is identify the frequency with which a player injured during the season, determine the type of injury they present in the year named, that is the 2023, and the last are determine the associated factors with an injury.
Methodology. Therefore, the type of design and scope of the research is based on the fact that the research of the characteristics of the observational of and transversal types. In this research, it is expected to discover the prevalence of injuries in more soccer players or lower categories of the Cortubat Sport Club. For the hypothesis of the research, it is expected that out of 34 players that make up a club to be investigated, 11.42% of them are injured during a season, with these injuries occurring more frequently at the end of any of the two regulation health. So, population and simple. In the population group, 44 more players belonging to to the lower categories will be taken into account for the approach. They should have an injury prevalence of 9.6% and 8.1% for every thousand of sport play, with a permit error of 5%. According to the above, inclusion criteria are established which are men liked to the cultural sport club that are in the age region of 13 to 17 years old and that have a minimum of 3 months of belonging to the club. So, in the exclusion criteria, the individual who will not be part of the research will be female players who have less than 3 months of belonging to the club, who during the last 2 months have present sometimes injured and who don't meet the requirements of the age range. Next, so technique and instruments. For this, we will take into account several techniques and instruments such as the anamnesis of the user in order to know the condition of the athlete. In addition to several tests and semiological tests to evaluate the stability of the knee, as the Langemann test, with a sensitivity of 0.87% will be the test to be used to merge an ACL rupture. Ankle drops test as a specificity of 0.96%. These tests are performed with the objective of detecting anomalies of the ankle level, specifically in a sprain of this young complex. These tests are used for diagnostic of anterior cruciate ligament abnormalities. In addition to the test of drawer for ankle in which the ligament stability in the joint complex of ankle is evaluated, taking into account that following the alteration of the ligament, it will be qualified in the grade of corresponding spring for grade, maybe grade 1 or maybe grade 3. Being grade 3 where a complete research of the ligament is evident. So finally, although there are several techniques for the measure of patellar tendinopathy. The School of Victor Institute of Sport Asthma. Next. So, the School for Victor Institute of Sport Asthma, BISAP, is based on the accomplishment of questionnaire with the groups of measure the symptomatic severity and functional and sport capacity. When realizing it accounts on major objectivity signs, it consists of 8 items which classifies the pain during the daily activities and the functionality tests in a numerous scale of classification may be of pain in from 0 or to 10 two items that offer information on the sport participation. Finally, the maximum possible score is 100 points, which corresponds to an asymptomatic athlete. And the minimum possible score is at 0 points, taking into account that it is a crowage alpha equal to 0 0.98.
Date y analyze. Okay. In the data analysis, for that collection, we used the cultural clubs database, extracting the injuries that had occurrence during the years 2023. We did transferred this information to Excel version 2015. Where the data was cleaned and organized. Then the information was analyzed by means of Yamobi version 3.1, where she queried status of association for categorical variables was performed. This statistics allowed us to interpret the relation between two categorical variables. Okay. Now in training the result of our shares table one. The table one show that that there is not statistically significant association between being in the sub 14 or sub 15 categories and having a group to unclosed prime with a p-value of 0.947. However, it is evident that there were more injuries in the sub 15 category compared to in the sub 14 category. The follow table show the proportion of injury during training compared to official match in the evening that the number of injuries during training is higher. Although there is in the statistical significance difference between players' injuries in the training compared to those injuries in official match with a p-value of the 0.076. Okay. In the last table, it can be seen that there is not a statistical significant association between present ACL rupture in the training or competitive practice match. To conclude, the result in the number one is evident that the percentage of injuries in training is higher compared to to those injured in official match, we can also see that there were more grad to ankle sprain injury in the sub 15 category compared to the sub 14 category.
All talk about the discussion below. Luis Caso and co-author found that in 27-month period, 229 injuries were recorded, of which 169, 17 were recorded during training, and 30 in person, 17 in friendly matches, and 122 during the regular season, and 60 injuries, 26 occurred during official matches. Stephen Jones and his group of research found that the most frequently occurring injuries result in soft tissue damage, with more severe injuries such as fractures being less common. Lower extremity injuries were the most common, with injuries to the ankle, groin, and hip joint usually being the most common. Injuries in lower level players tend to be more prevalent depending on the stage of growth and the sport. The closer to effective levels, the greater the likelihood of injury. However, such injuries occur more frequently at the time of strong time competition. Therefore, further studies and the larger sample population are needed to officiate the results that odds reached gained.